Thanks for attending the lecture on knee pain. In conclusion, as you'll note on the slide, last slide, just have to know what kind of guidance and modalities are available for you to be successful with your introduction to a lifestyle change or your endeavors when you are training for some form of athleticism or competition and you develop knee pain. Again, in the beginning we talked about pathology, so you have to listen to when you have the beginnings of your hurt or discomfort. Going down these steps at Devil's Lake can be easy. Going up would be a difficult problem, and as some of you had questions about taking on steps. No great way to do it, but I think that training with steps does put a lot of pressure behind that kneecap, a lot of excessive friction. So you really should listen when the discomfort starts, the ache starts, then it's probably time to take a break. Like for example, this is a step off, so you can step to the side, take a break, have a water break, apply ice if you've got a refreezable pack, and then continue on when the pain is gone. Just like taking a water break. So listen. If you can't get rid of the pain, you might want to still consider, I'll let some people pass here, might want to still consider taking a longer break or finding the fastest way out. That way you don't cause too much damage. Hi there.
Hi.
As in the earlier slides, when the pain is not listened to, stretch receptors in that bursa enlarge and you're full of fluid, and you continue with bad activity or high friction activity, then you'll wear away at the cartilage, and that sometimes, if you stop at that point, will be good enough to repair itself within 7 days. If you continue on and you have no choice, sometimes a long hike into high elevation will put you right in the middle of the highest point of the elevation, the summit, and you have no choice. You have to keep on going back down and the pain will continue. So at that time the cartilage can break down, and then if you flip back a couple of slides you will develop osteochondritis. That's when you burr down the cartilage in addition to taking chunks of bone away. When that happens, I think there's still some options to repair the knee, whether it's hiking, biking, walking in the mall, training for steps like in the Hancock. I think two of you had mentioned you're doing the steps at the Hancock. But when you tear away bone, then it becomes you're a surgical candidate for smoothing down the edges, and that wouldn't be good. So listen, know what your knees are telling you. Try to use those first aid maneuvers, RICE, in addition to adding maybe turmeric, and I put down on the slide my favorite brand. It doesn't have to be Gaia, but as long as it has pepper in it, or piperine. Piperine and turmeric work great together. Many of you use glucosamine sulfate, and that's also great. Remember, it can upset the stomach at 1,500 milligrams a day, but most studies now are saying that as long as you don't have any pain in the stomach, then you can take it even with Advil, but defeating the purpose of avoiding Advil. So those two things, ice therapy, maybe seeing a sports medicine specialist, physical therapist if you can get a prescription from your primary care doctor, or an orthopedic surgeon. If you don't have options with that, or don't have insurance or very high copay with insurance, acupuncture, exercise physiologist, chiropractor, all very useful. So hopefully you do well in your endeavors, and we'll see you out either on the trail or in the classroom. Just stay safe and continue on to make that sustainable change. And before you know it, you will have accomplished your goal, become healthier than you ever thought you could get healthy, and started on a new life. And here we are at the bottom, so good luck and thanks for watching.